Hello, my name is Dr. Okun. I'm a GP in Hartford Health Center. Diabetes can be overwhelming. No one chooses to be diabetic, and it is no one's fault. But when someone receives the news that they are diabetic, they feel isolated, alone, and not sure of the future. I hope discussing common issues in diabetes will help you manage diabetes better. Our hamlets have a higher than average rate of diabetes compared to the rest of the UK. There are two main types of diabetes, type 1 and type 2. I am going to talk to you about type 2 diabetes. Type 2 diabetes is more common in older age groups and in those who are overweight, as well as those from South Asian, African, and Caribbean backgrounds. The risk is also higher in women who may have had diabetes during pregnancy. Most diabetics may not necessarily display or experience any symptoms. Diabetes can be diagnosed with a blood test. All GP practices do an NHS health check when you turn 40, and this includes a blood sugar test. Sometimes you will notice symptoms like passing urine frequently, feeling tired, feeling thirsty, and suffering from regular infections and genital thrush. Please speak to your GP if you have any of these symptoms. Type 2 diabetes develops when the body becomes resistant to insulin or when the pancreas stops producing enough insulin. If you have been diagnosed, you will be invited to an annual health check, a flu jab, a jab for pneumonia, and you'll be referred to a diabetes education program and for eye testing. Diabetes can affect any part of your body, and the health check is vital to look for any other changes to your body. Diabetes cannot be cured, but if managed properly, you can lead an entirely normal life. Diet and exercise play a huge role in the management of diabetes. High blood sugars occur if there is a mismatch between how much we eat and our activity levels. Stress and infection also play a role. A balanced diet is important, and it is also important to spread meals across the day rather than having one big meal. You are advised to have between 5 and 8 portions of fruit and vegetables and between 5 and 8 portions of starchy food like rice, pasta, potatoes, and bread every day. You must also incorporate 2 to 3 portions of protein like eggs, chicken, fish, and meat, as well as 2 to 3 portions of milk and dairy products. A portion size is a handful. It is important to reduce the quantity of oils, snacks, crisps, and cakes from our diets. Exercise means physical activity of at least 30 minutes per day, 5 days a week. If you are trying to lose weight, you should exercise at least 1 hour per day. I cannot stress enough the importance of taking medication for diabetes management. We are all scared of taking medication, but the risk of not taking them can be disastrous. We now know how to manage high blood sugar levels. but it can also become low. A low blood sugar is less than 4 and can cause you to feel hungry, dizzy, experience fast heartbeats, and to start sweating. You will need to take sugary products like 4 big jelly babies, 150 milliliters of Lucozade, or 200 milliliters of orange juice. This will help bring sugar levels to normal. I hope this message has helped you understand your diabetes better. Please speak to your GP for more information.